Welcome everybody to the second of the double headers today. Thank you very much. And again, I'd like to acknowledge the traditional custodians of the lands and waterways in which we're passing today. And today we are in Camaragal country, and like to acknowledge elders past, present and future and emerging for the continued custodianships. All right, so we have everybody on board. So before I hand over to Emma for her presentation, I'd like to acknowledge today's CoC panel is being chaired by Professor John Marshall-Reeve. Professor Jenny Sim is one of our leading experts in this, as well as Dr. Bridget Booker, who's the other expert. And on Emma's PhD panel, we have Professor Kim Foster, Professor Jesse Gao, and also thank you, Karen Takiri, who is the Associate Supervisor and is online today. And they're all being led by the most competent, most excellent Professor Teresa Dickey. And so without further ado, Emma, the floor is yours.
Thank you so much, Brittany. And thank you all for being here today. At some point in our lives, we will all require a nurse. And although nurses form the backbone of our healthcare system, they are increasingly experiencing strain. My research not only focuses on the demands that nurses face, but also the psychological mechanisms that can enhance their well-being. I do this today by integrating job demands resources model and self-determination theory. All right, so to provide a brief overview of everything, I first want to outline the significance of nurses, as some of you may not be as familiar with the nursing profession, and then I'll also go through current challenges that they face. I'll provide an overview of what I plan to do for my PhD, and I'll go through the critical frameworks that guide my research today. And then I'll go through each of my study aims. So nurses are very critical to the care that we give in our communities today. And then work extends way beyond basic caring duties. They're the ones that provide clinical, have to make difficult clinical decisions. They constantly have to assess patients, they deliver and treat patients, and they are ones who are oftentimes the first to notice subtle changes in conditions. They work across various settings, such as hospitals, aged care and community facilities, and across a wide range of specialties, such as mental health and oncology. And their work isn't just clinical. Nurses educate, they advocate, and they oftentimes are the ones who support families and individuals through the most difficult and significant moments of their lives. With the aging population and chronic complex conditions increasing today's society, the need for nurses is only increasing. So although from the outside, the nursing profession seems extremely fulfilling and meaningful, you would think it would be a type of career that would be sustaining, although results and data is showing the opposite. For nurses, burnout and emotional distress is increasing. A recent statistic in Australia has found that 84% of healthcare professionals, with majority of them being nurses, are experiencing burnout. And burnout has significant professional and personal consequences. It's been associated with reduced quality of care, increased clinical errors, lower well-being, and ultimately it causes greater turnover. So there's quite a few stresses that contribute to this burnout. Some of them include working long and unpredictable work hours, working in high pressure and fast-paced environments where they have to make critical clinical decisions very fast. They often experience conflicts with patients and families and even colleagues and doctors. And they oftentimes are exposed to suffering and death, which has a very large emotional toll. On top of this, their workload is only increasing, adding to what is an already extremely demanding role. So overall, for my thesis, I aim to examine how job demands and job resources with the nurses is influencing their outcomes via negative and positive need-based experiences. And I'll be doing this through conducting my 3 studies, which will be 1, a meta-analysis for study 2. Study 2, I'll be doing cross-sectional study, and for study 3, I'll be doing a longitudinal study design. So to provide an understanding how job characteristics lead to certain job outcomes, I'll be drawing from the job demands resources model. And according to this model, this occurs through outcomes that cause through 2 different types of processes, including job demands. So when job demands are present, such as having a heavy workload, that is associated with adverse wellbeing outcomes and burnout. Whereas when job resources are present, such as social support, that is associated with more positive wellbeing outcomes such as engagement and motivation. Although the JDR model provides an understanding how certain job characteristics lead to certain outcomes, it doesn't explain the psychological mechanisms to why this happens. So therefore, my thesis also draws upon self-determination theory. And according to self-determination theory, as you probably all are very familiar with, well-being and motivation is dependent on 3 basic psychological needs: autonomy, confidence, and relatedness. Our work environments can strongly influence whether we're satisfied and frustrated by these needs. They can either actively support these needs or thwart these needs. And as a result, when these needs are frustrated, that often leads to maladaptive outcomes like distress and burnout. Whereas when these needs are satisfied, this often leads to more adaptive outcomes such as commitment and engagement. So therefore, my thesis aims to integrate both the job demands resources model and self-determination theory together, focusing particularly on the dual process framework. So from my thesis, when job resources are present, therefore it's more likely that our needs are satisfied, or we're in environments where our needs are supported, and therefore leading to more adaptive work outcomes. Whereas when job demands are present, they're more likely for our needs to be frustrated or thwarted in the environments we work at, leading to negative work outcomes, such as burnout. To provide a specific example of one of these pathways, imagine a nurse working in a busy emergency department in a short shift. She has a heavy workload and she has limited time per patient. As a result of this, her autonomy lowers as she feels that she doesn't have much control over the tasks that she has, and her competence also lowers as she feels that she doesn't have enough time to spend with each patient. As a result of this, this increases the risk of burnout. So what we still don't know, majority of the research that we have today on nurses focuses on how job characteristics predict certain work outcomes. And we rarely understand why this happens via psychological mechanisms. Even a small number of studies have integrated how the JDR model and self-determination theory integrate within healthcare and nursing. And more specifically, looking at how job conditions influence nurses through basic psychological needs. Even fewer studies have looked at how these pathways occur over time and across countries. Now, you're probably wondering, why am I focusing so much on psychological mechanisms? Without understanding why job characteristics lead to certain outcomes, current interventions remain broad and resource intensive. When we look at certain psychological mechanisms, specifically looking at satisfaction of basic psychological needs and frustration of basic psychological needs, we will know what to strengthen, and we'll know how to make more targeted interventions and more theory-grounded interventions that don't just focus on reducing workload and job demands. So my overall aim for study 1 is to synthesize, conduct a meta-analysis looking at how these distinct pathways operate in healthcare, more specifically looking at how the satisfaction and frustration of basic psychological needs predict adaptive and maladaptive outcomes. And this is important to know whether this exists in healthcare, as no previous evidence has examined these pathways among healthcare and other healthcare workers, and how strongly these pathways are linked to key organisational outcomes. So for my meta-analysis, 2 main research questions guide my research. I'm looking at these distinct pathways. Question 1 focuses on the strength of the association between nurses' experience of basic psychological need satisfaction and adaptive work outcomes. And my second research question focuses on how basic psychological need frustration leads onto maladaptive work outcomes. So for my meta-analysis, I'll be following PRISMA 2020 guidelines, And I'll be using 4 major databases will allow me to provide a comprehensive overview of nursing, psychology, and health science research. My meta-analysis will occur within 2 stages, title and abstract screening and full text screening. For the inclusion criteria, all studies have to be empirical and conducted within healthcare settings. They have to use either nursing or healthcare professionals as their participants, and they must measure at least 1 basic psychological need and report at least one adaptive or maladaptive outcome. So the main analysis for my meta-analysis will be a 1-stage meta-analytic structural equation modeling. And by doing this, will allow me to simultaneously look at conducting a meta-analysis and structural equation modeling, which will allow me to look and test at the dual process model. If sufficient data is available, we will also be conducting a moderator analysis with moderators including career role, career stage, healthcare setting, and clinical specialty. So while study 1 looks at the dual process model and looks at these distinct pathways of basic psychological needs and outcomes within healthcare and nursing, study 2 aims to actually incorporate both self-determination theory and the JDR model, looking at how the influence of basic psychological needs and basics and work characteristics lead to certain outcomes. This is important because it will help identify why certain job conditions influence well-being and through what psychological processes. So 2 research questions mainly guide my study 2. First one being looking at the basis JDR model of whether how certain job demands and job resources relate to my key organizational outcomes, burnout, and meaning of work. And my second research question focuses on the mediation of satisfaction of basic psychological needs and looks at the relationship between the job characteristics and the outcomes. So the design for study 2 will be a cross-sectional design, and I will be using secondary data set from 425 Australian nurses. Job demands and job resources and the key occupational outcomes, burnout and meaning of work, will be measured using the CoC version 3 questionnaire, and satisfaction of autonomy, confidence and relatedness will be measured using the shortened self-determination theory scale. We'll be also collecting basic demographic variables, which will help us describe the sample and contextualize the finding. So the main analysis we'll be using for study 2 will be structural equation modeling. This will allow me to look at the direct and indirect effects and make the focus on the mediation using, and mediation will be conducted using bootstrap confidence intervals. So while study 2 allows me to look at the interaction of self-determination theory and dual process and the job demands resources model, specifically looking at how certain job characteristics lead to outcomes through the influence of basic psychological needs. That only focuses at a single time point. My study 3 aims to extend on this by looking at how job conditions have enduring effects on burnout, and how they do so through a need-supported and need-supporting work environment. So similar to study 2, my research question will also focus on the baseline JDR model, but focuses on how job characteristics, specifically job demands and job resources, predict changes in nurse burnout over time. And my second research question looks at how this is mediated over the relationships over time between work characteristics and outcomes. So for my study 3, we'll also be using secondary data set from the nurses early exit scale. Early exit study. So that's a study that was conducted with 10 European countries to assess nurses' experiences. measures used were derived from validated instruments such as the CoC, and also there was additional scales developed specifically for this questionnaire. The scale involves a baseline questionnaire, and then that same questionnaire was delivered 12 months later using nurses that remained within their institution. So the main analysis that I will conduct for study 3 will be a cross-dive panel model that will allow me to focus on the temporal inferences over the relationships and the mediation. Because of the the nesting nature of the data with the different countries, we'll also be considering that using cluster robust standard errors. The different countries will also allow us to generalize the findings and contextualize it across the context. For the mediation, we'll be conducting that from job characteristics to predict changes in burnout through the mediation of need support and need thwarting, controlling for baseline levels. So basically, all these 3 studies have been developed to build upon one another. To answer my main core research question, which is what job characteristics lead to what certain outcomes and through what processes. Study 1 establishes this by incorporating the dual process model, which allows me to look at these distinct pathways. And then Study 2 develops on this by looking at the interaction of the job demands resources model and self-determination theory, allowing me to look at the interaction of job demands, job resources to outcomes through basic psychological needs. Study 3 will extend on Study 2 by allowing me to look at this relationship over time and generalize findings across multiple countries. So findings from my study will help healthcare organisations create healthier work environments. This is by moving beyond just focusing on reducing job demands and increasing job resources, by steering the focus more on looking at basic psychological needs and how and their influence. This could be specifically through strengthening leadership support, increasing decision-making autonomy, and fostering environments that support relationships among co-workers in the nursing environment. Overall, this enables more targeted and sustainable workforce strategies and interventions. Fantastic. And this is my timeline. So I'm currently still developing my protocol. But soon when that's developed, I will be soon submitting that to Open Science Framework. Perfect. And that concludes my presentation. Thank you for listening.
Thank you. Head over to John Marshall.
Okay, thanks. Let me just ask one general question and then I'll hand it over to our first, you did a lot of work from the paper to the presentation. Presentation is much better. It's a good presentation. I really like it. So let me ask you one general big macro question, and that's it. Could you just pause for a minute and just summarize the dual process model and tell me what you need to, what paths you need to test to evaluate the dual process model?
Well, the complete dual process model looks at not just, I mean, I know I've shortened it where I've looked at just need satisfaction and need frustration to adaptive and maladaptive outcomes, and I've not looked at need thwarting and need supporting in the dual process model for the meta-analysis. But I think for because I'm incorporating the JDR model, I've decided that I just want to make the main focus on need satisfaction because essentially to not make the model so complicated.
Okay.
It's all right. Thanks, John Marshall. Right before I go to Bridget, I'll hand over to Jenny. Jenny, thank you.
So thanks, Emma. That was a great presentation, and thank you also for the written material that you shared. I agree with the previous speaker that you've obviously done a lot of work in trying to plan your study. I guess I've, as a nurse, as somebody who works in nursing, I guess I'm trying to get my head around how you're going to study in the way you've planned something that is so complex and so individualized, not just with the individual nurse, but in the individual ward or team or environment, then in the individual hospital. You've got national data, you've got international data, and nursing's not particularly great at even having the same qualification levels in different countries of the European countries you're looking at. Not all of them have similar curricula or similar scopes of practice. So I guess the complexity of the process and what you're planning to do is what interests me. And I'm just wondering what your thoughts might be around how you're going to be able to do that across your study.
Yeah, no, that's a very good question. I guess for my study too, across like specialties and across different settings, I do plan to add covariates so I can control for those differences and consider the differences among potential study findings there. Another thing as well for study 3 with the longitudinal study, I think the main thing, because you do bring up a very good point, I think we would like to focus as well as we like handle that there might be differences across findings. We will probably look at differences also across, we're considering looking at differences across countries and seeing their potential, like for example, like what specific job demands or job resources are more specific to certain country groups, and differences among there, because of course different countries will have different policies and legislations around nursing. So yeah. I think that would be important and interesting to look at. All the existing data sets all consider what specialty, what role, like are they registered, are they enrolled nurse, if they're working in mental, like if their specialty is mental health or emergency, like it all kind of considers that stuff. So due to that variance, I think we will have to consider that, incorporate that into my model.
Yeah.
Does that answer your question?
I think it starts to. I guess I'm not really expecting you to have an answer. I guess I'm posing it as something for you to consider and think about. Mm-hmm. And I think the other thing for me is just you're using secondary data sets for both of your, phase, your second study and your third study. I guess I'm interested to know how old those data sets are and what the primary objectives of those studies were, because obviously the quality of the data that you have is going to have an enormous impact on the quality of your analysis and your ability to actually, I guess, have implications for practice that you're so keen to do within your presentation. So a little bit more about those secondary data sets would be helpful for me.
Yeah. So my longitudinal data sets are pretty old, but I do think the main focus of it was because of looking at nurse experiences and looking at the retention of nurses and seeing them, seeing the relationships of those nurses potentially leaving the organization. And I think the data set is still very relevant today because it has a lot of the job demands and job resources that nurses are still experiencing today. So I still think
but are they experiencing them in the same ways? So given that data set is, I had a bit of a look, like, almost 20 years old. Yeah.
Mm-hmm. Yeah.
We've just done a new contemporary definition of nursing practice because the old ones weren't good enough. They didn't reflect the way nursing is now practiced and conceptualized. So is the data that nurses experienced that many years ago, is it actually going to help you to answer your questions that relate to nursing now? I'm not expecting you to have an answer. I'm just posing it for you to think about.
Yeah,
Yeah.
no, definitely. I'll take that into consideration.
Thanks, Jenny. Let's hand over to Bridget.
First of all, congratulations. Well presented, the new document was very clear and well presented as well. I have kind of well, jumping off that, my question is kind of around as well the levels. So we look at individual levels, workplace levels, and kind of like the wider healthcare system.
Mhm.
So a lot of what you're presenting was based on like kind of the workplace kind of individual levels.
Mhm.
And so where do you think individual workspace levels have the most influence compared to where maybe some of more of the bigger structural issues are? So where the influence of the healthcare system. So this is kind of based on literature and your background, or what you've looked at here. Where do you think? Let me try to do this a little bit more clear. Where are more of the issues driven by the larger healthcare issues rather than the workplace issues?
Like, are you asking what specific demands may be influenced by the systems within healthcare? Is that what you're, rather than the personal, like?
Yeah, so my background is public health, and so we always look up the upstream factors and the downstream factors, right? So when we're trying to prevent an issue, we want to try to address the upstream factors, so the bigger, larger health systems. So what issues do you think are more important in the larger health issues compared to the individual issue in workplaces? This is just a general rock question.
Yeah, no. I think within healthcare, because there's such a shortage and a lot of people are leaving the industry, a lot of the times I feel like the work, as a result of that workload, is like a massive one that increases, and that's not so much like something individually you can control for, that's like something more broad from what's happening else from the systems. And I think that's why my research is important, because you can't really reduce when so many people are leaving. There's only so much systems can do to reduce workloads. So by looking at the psychological mechanisms, we can look at like potential strategies to like enhance those needs to overcome something that industries can't really control for. So that might be more decision-making autonomy, or improving leadership via autonomy supportive leadership training, like that kind of stuff. So I think that's important, but like there's other stuff as well, like there's personal resources that people have, like resilience. That's a really important one. That's an individual. That's more catered to the I mean, organizations can also increase that via like training. Does that answer your question?
All right, thanks, Bridget. Before we open to the floor, John Marshman, did you have any follow-up questions?
I'll wait to see if there's time.
All right, we have done.
Could you just take a minute and kind of elaborate more on your measures and defend them a little bit? Are you confident in them, and why? So how do you measure resources, demands, psychological needs, outcomes?
Yeah, so for our job characteristics, we will use the CoC, which is the most for my study 2. It's the CoC, the most latest version 3. Which is, of course, that's not specific to nurses, but we have had nurses come in and incorporate their feedback on how to make questions more specific to nurses. For basic psychological needs, we also have items for the second study specific to need satisfaction. And then for outcome.
What is that scale?
Of the scale that we use. It's been, I can't remember on the top of my head, I can't remember its full name, but it also has been shortened.
Sorry, what was it?
The one we use all the time, the base.
So it's the one from the school
Yeah.
principal to
Yes,
apply
yeah.
to nursing, so it's a full.
Yeah.
Or a subset.
It's a subset outside. With the
Is
GA.
it a single item or something like that?
No,
You can say that, you could say that, okay. So it's like 5 items for relating to satisfaction, 5 items for relating to frustration, something like that,
It's got 3 items for each need.
and outcomes.
Outcomes, we're also using the CoC for study 2 to measure burnout and meaning of work. And then for the longitudinal study, that uses a whole variety of different measures and scales that are validated and developed specifically for that study.
Do they have the SDT scales?
They don't, but a lot of they have scales that we can use for needs supporting and needs supporting.
Cool. Thank you, Joe Marshall. All right, just got enough time for one question from the floor. Open it up. Herb?
Tricky issue with moderation and mediation.
Yes. Yeah.
And you've gone through moderation or mediation.
Mediation.
You depicted it as full mediation, but it's probably partial mediation. With the psychological needs. Why did you choose not to look at moderation in addition to or instead of mediation?
That's a very good question. Well, the main aim for my research is to see if psychological needs can explain why these job characteristics can lead to certain outcomes. I'm not looking at the interaction effects. I'm not looking at different levels of I'm not looking at the different levels of variables. I'm not focusing on the interaction effects. I'm more focusing on if job characteristics can be influenced. Job characteristics can influence basic psychological needs, and therefore outcomes. But I could potentially consider doing a moderation mediation for, I don't think I could for study 2, I don't think I have enough power, but maybe for study 3 of the longitudinal study, if I still use that data set, I could consider doing a moderation mediation and incorporating those both so I can actually see the interaction proposed by the JDR model, seeing if job resources can mitigate the effects of job demands on burnout.
Okay.
All right, thanks, Herb. All right, so before we thank Emma, just ask Kim, Karen, and Jenny to stay on the line. Thanks very much for your time, people online and in person. Round of applause for Emma. Thank you. Well done. Thanks, everyone. So, setting up. All right. Everyone's online. You can hear us there. Thank you. All good. All right. I'll switch off on my side and you're good to go. We don't need to drag in here. Teresa? Yes. Teresa and your Marshall. Oh, she's here.
Is that it?
You've got notes?
Jesse has. Oh, and Jesse.
Oh, Jesse. I forgot about Jesse.
No, John Marshall.
Joe Marshall's got to do the notes. Oh, he's got his laptop. Excellent. He's going to take notes. Good on you. I've trained you well. All right. Jesse, I'll get Jesse. Thank you.